Imagine looking in the mirror and noticing something different about your eyes. Perhaps they seem drier, irritated, or even appear larger than usual. For many, these signs might seem harmless, but they could indicate something far more serious: thyroid eye disease. This condition is more common than you might think, especially among individuals who already have thyroid issues, such as hyperthyroidism. The problem? Early symptoms are often ignored, which can lead to complications that affect not only your appearance, but also your eye health. Are you at risk? Knowing how to identify the signs and understanding the root cause of this problem could be the difference between timely treatment and facing more severe issues in the future. Stay with me to uncover the main signs, who is most susceptible, and what you can do to protect your eye health before it's too late. 1. What is thyroid eye disease and what causes it? Thyroid eye disease is an autoimmune condition that primarily affects the tissues around the eyes, such as muscles, fat, and connective tissue. It is characterized by an inflammatory process triggered by a dysregulated immune response. Instead of protecting the body from external agents, the immune system starts attacking healthy structures in the orbital region, causing significant changes. This disease is closely linked to thyroid gland problems, especially Graves' disease, the leading cause of hyperthyroidism. In many cases, the hormonal imbalances associated with this condition trigger the immune response that leads to TED. However, it can also occur in people with hypothyroidism or even those with normal thyroid hormone levels, though this is less common. The exact reason why the immune system begins attacking orbital tissues is not yet fully understood. However, it is known that there is a genetic predisposition. Some people are more likely to develop the disease due to their family history. Additionally, external factors, such as smoking, appear to exacerbate the condition in terms of both risk and severity, as smoking intensifies inflammation and reduces the effectiveness of treatments. Another important aspect is that TED is not solely caused by hormonal imbalances. While thyroid dysfunction plays a central role, the autoimmune inflammation characteristic of the disease often occurs independently. This means that even after thyroid hormone levels are stabilized, inflammatory processes in the orbital region can persist or even worsen, requiring specific treatment for TED. Therefore, thyroid eye disease results from a complex interplay of genetic, autoimmune, and environmental factors that cause the immune system to attack the structures around the eyes, leading to the characteristic changes of this condition. 2. Early signs and symptoms. The early signs and symptoms of thyroid eye disease can range from mild discomfort to more noticeable changes around the eyes. It is common for the initial symptoms to go unnoticed or be mistaken for other eye conditions, such as allergies or dry eyes. However, recognizing these signs is crucial for seeking medical help and preventing progression to more severe stages. Early symptoms include a sensation of dryness in the eyes, as if there were sand or dust, and increased tearing, even without apparent irritation. Many people also report redness and slight swelling of the eyelids, as well as sensitivity to light. As the condition progresses, a feeling of pressure or pain behind the eyes may develop, caused by swelling of the tissues in the orbit. Other signs that warrant attention include eyelid retraction, when the eyelids appear pulled back, exposing more of the eyeball, and the appearance of bulging or protruding eyes, known as ptosis. This hallmark feature of the disease may develop gradually, making it harder to detect immediately. TED can become dangerous when symptoms begin to affect critical functions such as vision. If you notice double vision, difficulty moving your eyes, or blurred vision, it may indicate that the eye muscles are inflamed to the point of impairing their movement or compressing the optic nerve. Another warning sign is persistent or severe pain behind the eyes, which may indicate increased orbital pressure. In advanced cases, swelling can compress the optic nerve, leading to gradual vision loss, which can become irreversible if not treated. If symptoms progress to these more severe characteristics, or if there are rapid and significant changes in the appearance of your eyes, it is essential to seek medical attention immediately. Paying attention to eye changes that do not improve or evolve quickly is key. Recognizing early signs and acting promptly can make the difference between controlling the disease and facing permanent complications. 3. Diagnosis and treatment. Diagnosing thyroid eye disease involves a detailed analysis of the patient's medical history, physical exams, and additional tests to confirm the condition. A doctor, typically an ophthalmologist working alongside an endocrinologist, starts by assessing overall eye health, looking for signs such as bulging eyes, eyelid retraction, and inflammation. In addition to the clinical exam, laboratory tests are conducted to measure thyroid hormone levels, such as T3, T4, and TSH, which are essential for identifying thyroid gland dysfunction. The presence of antibodies associated with Graves' disease, such as TRAb, may also be analyzed. In some cases, imaging tests, such as a CT scan or MRI of the orbit, are necessary to evaluate the degree of swelling or compression in the tissues around the eyes. Additional ophthalmological tests assess eye movement, vision, and orbital pressure, providing a comprehensive understanding of the disease's severity. The treatment of TED depends on the severity of symptoms and the stage of the condition. The first step is to stabilize thyroid function. This can be achieved with antithyroid medications, radioactive iodine therapy, or thyroidectomy, surgical removal of the thyroid gland, depending on the individual case. While hormonal stabilization does not directly address ocular symptoms, it is crucial to prevent disease progression. For the eyes, initial treatment may include the use of lubricating eye drops or gels to relieve dryness and irritation. In moderate to severe cases, corticosteroid medications are often used to reduce inflammation. These can be administered orally or intravenously, depending on the urgency and severity of the symptoms. For patients who do not respond well to corticosteroids, immunomodulatory drugs may be considered, directly targeting the immune processes that trigger the disease. When TED reaches advanced stages, especially if there is a risk of permanent vision damage, surgery may become necessary. Orbital decompression procedures, for instance, create more space around the eyes to relieve pressure and reduce eye protrusion. Other surgeries may address eyelid abnormalities or double vision caused by inflammation. This is why early diagnosis and personalized treatment are essential to prevent complications. The earlier the disease is identified and treated, the greater the chances of controlling symptoms and preserving both eye health and the patient's quality of life. 4. Tips. In addition to managing thyroid health through medical care, adjusting your lifestyle is key to achieving hormonal balance and preventing more serious problems. Small changes, such as improving your diet, organizing your routine, and prioritizing self-care, can make all the difference. To help with this process, I've created a comprehensive guide to make it all easier and more practical. With 21 days to support your thyroid, a practical plan to strengthen your hormones, you'll learn to adopt simple and effective habits that enhance thyroid health. And that's not all. In addition to the main plan, the guide offers healthy recipes, planners to organize your day, week, and even year, as well as tools like a habit tracker, self-care planner, and to-do list. Everything is designed to integrate thyroid care into every area of your life. If you want to transform your routine and take better care of yourself, click the link in the description and start your journey toward a healthier thyroid and a more balanced life today. One of the most important measures is quitting smoking, as smoking is strongly linked to worsening TED. Smoking increases inflammation, hinders treatment response, and is a risk factor for other eye and overall health conditions. Managing stress is also crucial, as it can trigger immune system imbalances and exacerbate thyroid symptoms. Practices such as meditation, yoga, and light physical exercise can support this process. Protecting your eyes is another simple but effective strategy. Wearing UV protective sunglasses can reduce light sensitivity and shield against irritants like dust and wind. Keeping your eyes hydrated with lubricating eye drops is also essential to avoid discomfort caused by dryness. Finally, regular medical checkups are vital, especially for individuals with a diagnosed thyroid condition. Routine exams, including thyroid function tests and eye exams, can help detect early signs of TED before it progresses. Awareness of symptoms is equally important. Many people are unaware that changes in their eyes may be related to the thyroid, and recognizing this connection quickly can make a significant difference in treatment outcomes. Thyroid eye disease is a serious condition that can profoundly impact quality of life. However, with early diagnosis, appropriate treatments, and lifestyle changes, it is possible to manage it effectively. Beyond the eyes, the thyroid can also affect other parts of the body, such as skin and hair health. These often overlooked signs may indicate that something is wrong with your thyroid. If you'd like to better understand how the thyroid affects the body in ways you might not have imagined, check out the videos in the playlist. They may reveal important details about what your body is trying to tell you.